Hi, so I hear you want to find out more about intrauterine methods of contraception, also commonly known as coils. Great! Well, this short video will guide you through all you need to know. There are two main forms of intrauterine methods: the intrauterine device, or IUD, and the intrauterine system, or IUS. They have a lot of advantages. They are highly effective, over 99%. They can be used for up to 10 years. They can usually easily be removed when no longer needed and should not affect your chance of then getting pregnant. The IUS is great at reducing heavy or painful periods. First, let's look at the IUD. The most common type of IUD has a plastic, T-shaped frame attached by a thread and coated with copper, so it has no hormones. The main way an IUD works is to stop sperm reaching an egg by preventing the sperm from surviving. It may also work by stopping the womb from accepting a fertilized egg. An IUD does not cause an abortion. It provides contraceptive cover for up to 10 years, but it can be removed at any time. Women with an IUD may notice their periods become heavier, longer, and more painful. Now, let's take a look at the IUS. An IUS, or Mirena, has a T-shaped plastic frame attached by a thread and coated with a sleeve containing a progestogen hormone. A steady, small dose of this hormone is released into the womb. It mainly works by thickening the mucus at the neck of the womb. This prevents sperm from passing through. It also makes the lining of your womb thinner, so it is less likely to accept a fertilized egg. The Mirena works for up to 5 years, but can be removed at any time. As it contains hormones, unlike the IUD, there is a chance that you may experience hormonal side effects, although most women don't, as the amount of hormone is small and mainly acts within the womb. Side effects may include breast tenderness, acne, mood change, and headaches. It is common to experience irregular light bleeding initially with the IUS. This almost always settles after 3 to 6 months. Periods may become much lighter than usual, and many women find that their periods stop altogether. This is okay, and it is not bad for your health. So I'm sure you want to know which method is best for you, IUD or IUS. Well, in most cases you can choose depending on your preferences. If, however, you suffer with heavy and/or painful periods, it is worth remembering that an IUD could make this worse, whereas an IUS is likely to help. Fitting of an IUD or IUS is usually straightforward, but it is important to be aware of the small risks involved. These include, firstly, infection. There is a very small chance of getting an infection during the first 3 weeks after a device is fitted. To reduce this risk, you should arrange a check for any possible existing sexually transmitted infections before the device is fitted. The device itself does not cause infection and does not increase your risk of getting a sexually transmitted infection in the future. Secondly, expulsion or displacement. There is a risk that the device can be pushed out by your womb. This is known as an expulsion. Or it can move, displacement. Although this is most common in the first 3 months after insertion, it could happen at any time and you may not know it has happened. This is why your doctor or nurse will teach you how to check your threads every month. Thirdly, ectopic pregnancy. Unfortunately, no contraceptive is 100% effective, but intrauterine methods do come close. If you do become pregnant while using these methods, there is a small chance that the resulting pregnancy could attach outside the womb, known as an ectopic pregnancy. But remember that the risk of an ectopic pregnancy is much greater in women using no contraception at all. Lastly, perforation. It is uncommon, but there is a small risk that the device could go through or perforate your womb when it is put in. This could cause pain, but often there are no symptoms. If it happens, the device may have to be removed by surgery. The risk of perforation is very low when a device is fitted by an experienced doctor or nurse. In order to be fully prepared for your fitting, it is worth having a sexual health check to exclude any sexually transmitted infections. It is also very important that there is no risk that you could be pregnant. So, if you're already on an effective method of contraception, then great. Continue taking this correctly until your fitting appointment. It is best not to rely on condoms alone, which are often less effective than other methods available. If you're not currently on a method of contraception, then you have two choices. Either start using a method as soon as possible. You can access these from your GP or local contraceptive clinic, or you can abstain from sexual intercourse from the first day of your period until your fitting appointment. You'll be asked about your medical history to check if these devices are suitable for you. Remember that these devices do not protect against sexually transmitted infections, so you may have to consider using condoms as well. The device is fitted inside the womb by a doctor or specialist nurse along with an assistant. The procedure itself usually takes 15 to 20 minutes. Before fitting, the doctor or nurse will examine you internally to find the position and size of your womb. The fitting can be uncomfortable or painful for some women, and you might want to take simple pain relief before you arrive. You'll also be offered pain relief at the time of fitting, usually a small local anaesthetic injection with a tiny needle at the neck of the womb, although a local anaesthetic gel may sometimes be used. You may get a period-like pain and light bleeding for a few days after the procedure. You'll be asked to return to clinic 4 to 6 weeks later for a checkup to ensure everything is going well.
I chose to have the copper IUD, and the reason why I chose this was because I didn't want to have the hormonal side effects that I had with other hormonal methods before, and also because it was a method that I didn't need to remember every day.
I chose to have the IUS fitted to regulate my really heavy and painful periods. That's what it's supposed to be good for, and I did, and it was almost, I'm not saying pain-free, it was a little bit uncomfortable, it was very manageable.
It wasn't as painful as I have heard that it would be. It was actually all right. I only had some period-like cramp after the procedure, but I didn't feel unwell at all. I was actually doing things in the afternoon as if nothing happened.
If someone has heavy periods and painful periods, I would recommend the IUS as a method.
So now you know all the key details about having an intrauterine method of contraception. We look forward to seeing you soon.